Hello everyone and welcome to the second lecture of the AMC preparation course and the second part of the principles of dermatology. So we will talk about the nail shapes and the diseases that associated with them. So when we will see any patient, we will look out for their nails and look out for any dermatological signs to narrow out the possible causes. So, first of all, we will have the nail pitting. As we can see here on the picture, we will have small round depression on the nails. So this appearance is caused by the presence of parakaryotic cells. It is impaired in the nail matrix. Over time, it will grow out to the nail plate, which is this one. This is just some information to know the cause, but the most important thing is to see it. This is called nail pitting, small depressions on the nail. This sign is associated with psoriasis. So everyone knows psoriasis. So this is a patient with psoriasis usually will have nail pitting on his nails. Now, the second thing, we will have ankylosis. So it's the separation of the nail from the nail bed. So this is the nail. The nail bed is the like the place under it. So this white thing, it's there is a space between the nail and the nail bed. That's why it's lighter than this part. So there's a separation. So we will be seeing this condition. Here's the same thing. This is normal. There is a separation here. So we will see it in a couple of conditions like repeated nail trauma, chronic irritant exposure, onychomycosis, which is a fungal infection, psoriasis, and thyroid disease. So this patient here, as we can see, there is a nail separation here, as well as he have onchom, onychomycosis infection, which is so now we will move to the nail clubbing. Nail clubbing is this condition where we will see the fingers to appear like this. We can see it in a couple of conditions, like first of all in pulmonary conditions like cystic fibrosis, bronchiectasis, and bronchogenic carcinoma. In cardiac conditions, sometimes due to congenital heart diseases, right to left cardiac shunt, and endocrine, we'll see it in Graves' disease, and gastrointestinal in some inflammatory bowel disease, celiac disease, and cirrhosis. So this is there is this sign, Charworth sign, I think. I'm not sure about the pronunciation. So it is a test to see the nail clubbing. This is the normal conditions. If we put the nails next to each other, they will like get attached to each other. While in clubbing, because of the shape of it, it will give us this shape. It's like, what do you call it, triangle here. And also in the phalangeal depth ratio, we will see an increase in the DBD ratio more than the IPD. So this is the clubbed and this is the normal signs. Nail clipping can appear in the foot as well. So here we can see nail clipping in the foot. Now the next condition, Koryonkia, or the spoon-shaped nail. So this is the spoon and this is the nail. We'll see it. It's like a spoon-shaped nail. It's also called like this. It's most common to appear in iron deficiency anemia. There's also some other conditions like some genetic predisposition. Some people are normally have nails like this, but if it was normal when they get born, then it will be like this. So it's uh, a sign of iron deficiency anemia, or maybe some exposure to petroleum products or trauma. So this is some other pictures to it. As we can see, it's a spoon-shaped nail. Then we will move to Mies lines. As we will have some white lines across the fingers. It can get caused from heavy metal poisoning, history of chemotherapy, or renal failure. I think. Okay. Yes. So metal poisoning, chemotherapy, renal failure. There's some other pictures of the Mies sign. This is a very good picture. Also this one, Mies sign, Mies lines. Sorry. And the final condition, which is melanonchia, which is just a dark pigmentation in the nail, usually a line on a side of the nail. It can be caused by benign conditions or malignant conditions. For the benign, it is just could be a physiologic trauma or drug induced, just like if we use some cyclophosphamide or chloroquine, and it could be inflammatory like psoriasis, fungus, navy, lentigo, and non-malignant tumors. For the malignant, we will have melanoma and Bowen disease. So now we will do a quick quiz just to check your knowledge and if you learned anything from this lecture. So let's start. So what is this condition? One, two, three. So it is measles. What is this one? This one is melanonchia. What is this one? Spoon-shaped nail. What is this one? Nail clubbing. What is this one? Oncholysis. What is this one? Melanonchia. And that's it actually. Thank you so much for listening. I hope you found this lecture helpful and you learned something. Don't forget to like and subscribe if you like the content. Thank you so much for listening and have a great day. Goodbye.